Welcome to Pawan Medical Info. Today we'll be discussing about the definition of diseases, different terminologies, what we have to use and characters of diseases. At last in detail today we'll be discussing about body responses towards various allergies. Coming to the definition, diseases are expression of discomfort due to structural and functional abnormality. So if any disease is there in body, that itself is discomfort, where you can see the structural discomfort. One will be concerned to anatomy, functional abnormality that is concerned to physiology. So whenever there is an abnormality, it may be caused by different agents like bacterial, viral diseases which come to infections, heat and radiation which can be categorized under physical agents. So all these things collectively are known as etiology. When you come to the characteristics of diseases, we can use different terminologies to understand better about diseases. First one will be etiology, second one pathogenesis, third one epidemiology, next one pathological and clinical manifestations, fifth one complications and sequel, and the last one will be prognosis. Let us see about each terminology in two sentences. Etiology, as everyone knows, it is the cause of the disease. Whatever is the cause of the disease, that itself is known as etiology. And when you come for pathogenesis, the mechanism causing the disease, the disease process going on in the body itself is known as pathogenesis. When you come to a word epidemiology, which is very important, it is the medical term which can be used to study about the occurrence of the disease, distribution, the disease and disorder which is seen in a particular population. In a particular population, when you observe a disease, how it is being distributed, what are the disorders suffering in that particular population, then that is known as epidemiology. In epidemiology, the one more important thing what is to be noted down is it develops prevention and it also concentrates on the control of the disease. When you come to the fourth one, that is pathological and clinical manifestations, the structural and functional features of the disease. What we have discussed in the definition of the disease, that is anatomically what is being disturbed, that is structural, and what is being disturbed in the physiology, it is about the functions of the body, then that will come under a heading known as pathological and clinical manifestations. When you come to the next one, complications and sequel. Sequel means it's a condition in which the consequences of a previous disease or previous injury is being discussed. If the patient who is suffering now, if we discuss about the injury or disease what he has previously suffered, then that is known as the sequel. And complications, as we know, these are the systemic complications what we observe in the patient. What are the things disturbed in the patient during the disease process? When you come to the last terminology and characteristics of disease, prognosis, that is anticipated and what is been happening in the disease and what is been happening in the patient, studying about the patient and the disease both together, that itself is known as prognosis, where the cure of the patient is very, very important, and we will be even studying about the disease process also. When you come to the factors of these characteristics of diseases, they can be discussed in two ways. One is the internal factors and one will be the external factors. Internal factors will be the genetic factors. The external factors will be the environmental factors. Coming to the last important thing, that is what is the body response towards various allergens. When you see the picture what is being given there, you can categorize them into four categories. One will be about skin abscess, we'll be discussing. The other one, lung cancer. Next one will be cirrhosis. And the last one will be hypertension. All the four we will be relating to the etiology. We'll be relating to the next heading, that is pathogenesis. The third one we will be relating it to the morphological and functional features. The last one, what is the complication, we will be discussing. When you come to the first one, that is skin abscess, the etiology will be Staphylococcus aureus infection The pathogenesis, when you observe, it may be acute inflammation. When you observe the morphological features, there could have been a skin abscess. Finally, what is the complication in the body means it is septicemia. I mean to say, any infection in the blood is known as septicemia. This is the first condition, that is body response towards allergies. When we see the second one, that is lung cancer, the etiology may be it is due to smoking, where the smoke contains aromatic hydrocarbons, due to which the pathogenesis will be genetic mutation. When you see the morphological features, it could have been a lung tumor, and finally the complication in the body is metastasis, that is secondary tumor. When you come to the third one, that is cirrhosis, the etiology may be due to hepatitis B viral infection. When you observe the pathogenesis, that could have been an immune reaction to the virus inside body cells. And when you observe the morphological features, that could have been cirrhosis of liver. Finally, the complication in body is liver failure. When you come to the last one, that is hypertension, there is a question mark in etiology when you observe the diagram. There is no relation of allergy with the hypertension, but when you see the pathogenesis, that could have been due to increased renin production from the kidney. And the morphological features or functional features, when you see, that could have been due to high blood pressure. And finally, the complications will be cerebral hemorrhage. So finally, today we have seen about the definition of disease and different terminologies, what we have to use in characters of disease. And we have in detail seen about body response towards various allergens. Thank you so much.